In today's video, I'm going to discuss an important two-letter word that's at the core of understanding any mind-body diagnosis, the chronic pain known as TMS or any of its equivalents. So in 1923, we had the Australian neurologist Sigmund Freud who came up with this term, the id, along with the ego and the superego, which makes up a person's psyche, and which is what influences one's own behavior. Now, for the sake of this video, we're only going to get into the whole impact of the id and discuss the importance of it. Now, what is the id? The id is your primal instinct. It's the unconscious part of your psyche, the part that we're not even aware of. We don't even know that it's in the background. So you can imagine your id as the child or a baby where all it wants is instant gratification. It wants pleasure, doesn't want to have anything to do with responsibility or being good. All it cares and all it wants and it craves is dependence on others. It wants nothing to do with being moral or following the rules of society or your family upbringing or even your religious standard. So the question is, what's this have to do with chronic pain? What does this have to do with your chronic constipation or your allergies? Well, here's the thing. Dr. Sarno realized in his early years of trying to figure out what's going on and treating his patients that his patients had certain personality traits, ones that are very typical in the majority of people in society. Now, by the way, if you're wondering, does that mean that the majority of people are experiencing mind-body disorders at some point in their life? The answer is yes, but this is beyond the scope of this video. Anyway, Dr. Sarno saw tendencies like conscientiousness, trying to be good to one's friends, to one's family and community, and also striving to be perfect at their job, just to name the most common things that he saw. And guess what? All of these things, all of these ways of behaving is in direct conflict with the nature of the unconscious id. Because again, the id can't stand responsibility, being perfect or being good. So whenever we conduct ourselves in such a manner, what's going to happen? You have anger and you have rage and you have pain. And as the rage and the pain accumulate and our unconscious feels that like it's too much of a threat, then it makes the involuntary decision to protect you from these negative emotions by way of distraction. Now, what would be the best way to distract someone with physical pain, with a migraine, with constipation, with allergies, with insomnia? We'll be so focused on the physical of going to the doctors, taking this medication, taking that supplement, going for that procedure, that surgery, and then what's going to happen to all that rage and pain that was generated in the unconscious and never surfaces. It stays unexposed, protecting our rational conscious selves from these negative emotions, which is exactly what our unconscious wants. So ultimately, this is a clever strategy created by our unconscious mind to protect us from harmful emotions. Now, most people are going to say, yeah, what do you mean? I don't really feel any of this. None of this is going on inside me. I don't know what you're talking about. And a lot of people, a majority of people, are going to deny this whole idea. But the answer is, of course you don't feel it, because it's in the unconscious. It's all taking place in the unconscious. This is part of your mind that you're completely unaware of. You're not going to feel any of this, any of these negative emotions. It's buried deep down there. It's buried deep down there, and not only that, your mind will make sure it does whatever it can to keep it there. So of course you're not going to feel it. You're not going to be aware of it. And so you might be wondering now, so what do we do? How can we get our symptoms to go away while still living our same lifestyle that we've been probably so used to living without generating all this rage and all this pain so that we don't have to have symptoms anymore? Well, that's going to be discussed in the next video, so stay tuned.